So you have pelvic floor dysfunction and you're wondering what your neck has to do with that. No one looks into that. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. When it comes to pelvic floor dysfunction, the most frustrating part for me as the provider is when people think pelvic floor dysfunction is the same as pelvic floor muscles, and pelvic floor muscles is just the muscles that are around your external genitalia, vagina or penis, and around your anus, and the space in between called perineum. Well, there is more to pelvic floor musculature, the whole lining of your pelvis. If it's like a bowl, the whole lining of the pelvis on the inside and all the muscles on the outside, the attachments of your hips, your sacroiliac joint, the pubic symphysis right above your pubic bone, or that's essentially that, and the lower portion of your mid-back. All of those are players of pelvic floor dysfunctions. They're influencers. Here's the problem. When your neck is forward, with that comes, I'm going to turn around. So if I'm like this, if my neck goes forward, there is an increase in my mid-back, and there is typically a shifting of the pelvis in the back. The alternative to that is when there is an hyperextension and sticking your chest out, your neck is still over here. The bottom line is your posture is compromised. When your posture is compromised, everything in your spine and your body is out of where its optimal position is. With a forward neck comes changes in mid-back. We already talked about the influencer of the pelvic floor is, one of the influencers is the lower portion of your mid-back and your lower back. I already discussed that portion. So over time, it's only a matter of very few days, if not sooner, that your pelvic diaphragm and your abdominal diaphragm, which are to be parallel to each other, they're no longer parallel to each other. So your breathing changes, the inner abdominal pressure changes. With the change in inner abdominal pressure, putting pressure on the pelvic diaphragm, when there is a shift in that disbursement of that pressure, if it's in the back, it's easier to get hemorrhoid, constipated. It's easier to have issues with urination, and a whole series of issues that go hand in hand with pelvic floor dysfunction. So a lot of times we're so busy looking at our health and our life from a pinhole with closed caption that we don't look at the overall dynamics of your presence in your posture and its influence on the pelvic floor. The biggest mistake is when we only address that issue without addressing the whole body and posture. In our practice, there is no option but to make them go hand in hand. If you have an issue that you can't help yourself with, give us a call using one of the methods of contact in the description box, and I'll see what I can do to find out what's going on. Thanks for watching.